Okay, in this video, I wanted to go over just some basic restraint examples with some of our animals positioned in different positions. So we'll start off with our little jaguar friend here, who's just kind of sitting, much like a big dog would likely sit in your clinic. And we're going to just restrain him in this sitting position. So the best way to do this is to utilize all of your body, or as many parts of your body as you can, to make it easier for you and hopefully less stressful for the pet. So with an animal in this position, I might just come around him like so, where I have both of my legs on each side of his sitting body, and I can hold around the head, underneath the jaw, kind of pull his head towards me this way, and allow a friend or the doctor to do an exam, medication administration, draw blood, whatever might need to be done. The important thing with this position, as simple as it is to make sure that the animal cannot stand up when he's in the sitting position. So that's again why we use our legs and our body to really help provide stability for the pet and make sure that he's not going to stand up and run away like you've maybe seen in that one video, right? So this position, again, kind of around the head, holding the animal kind of steady within your body, is a nice way to do very simple restraint and a dog that's maybe sitting in this position. Okay, the next one we'll do is our cow friend. We're going to pretend that this is a dog who is in sternal recumbency, so they're laying on their chest or laying on the ventral part of their body. And in this position, again, if this is what's comfortable for your patient, roll with it. If you can do whatever it is you need to accomplish with the animal in this position, do it this way. Again, when we perform restraint, we really do want to make sure that we're not stressing the animal out and making it, a gentle kind of thing as well. So in this position, they can stay sternal or laying in ventral recumbency, but we again want to make sure that they're not moving during whatever procedure we're trying to do. So in this case, again, I could come around and over the animal like this. I'm not going to necessarily sit on him, but I'm kind of positioning myself in a way that if he were to try to get up, my body is going to block him from doing so, right? The other thing is if he's, not fighting too much and you can just kind of get away with sitting beside him like this. You can see I'm just kind of behind him, and you can kind of go like this. You can use a little bit of your arm to kind of put over the pelvis area or the back end of the animal. So again, he cannot get up and move during whatever procedure you're doing. Same thing with my other hand, and this is always the case. You are always making sure to maintain control over the head of the animal. Okay, so you can do that gently like this. You can pull it a little bit tighter into your elbow. You can pull your whole body in if necessary, but you do want to maintain control over that head. So again, if we needed to do a procedure, I could hold him like this, draw blood, give whatever medication, perform part of the physical, etc. So this is an animal, again, in sternal or ventral recumbency, okay? All right, and then the last guy we have is our old buddy Robbie. So Robbie is just an animal who's standing, and this is just fine. We can do quite a bit with an animal who's standing. Just like you guys do in lab, you can just kind of stand beside the animal, right? And you can get down close and kind of around his side, and he can stay standing. If he's standing, you have to make sure he's not going to walk away, right? Or try to jump up or try to go backwards, okay? If you have an animal that you need to restrain a little bit more firmly, the best way generally to accomplish that is to put the animal in lateral recumbency, where they're laying on their side. And this is something you've seen, I think, before, but just a nice demonstration of how to get an animal into lateral recumbency. We'll use Robbie, who's standing here with us. So when we put an animal in lateral, we want to come up to the animal and reach over, and we want to grab the legs that are closest to me, okay? We do not want to grab these legs. That's not going to help. okay? So you have to go up underneath, you're grabbing the legs that are closest, you're sliding that animal down onto the ground, and then when you're in lateral recumbency, there are a few things you need to keep in mind. When the animal is laid down like this, he's probably gonna try to get up. You cannot let that happen or you have to start all over. So the best way to make sure he stays in lateral is hold on to the down legs. You have to hold on to them. With the hand that's over the head area, you can use your elbow and this part of your arm to restrain the head and neck. So again, he can't turn and bite me. He can't turn and try to wiggle away. You've got a nice restraint on the front end and the head. And then on the other arm, on the back end, you're holding the down leg again. And you're applying just slight pressure, again with your forearm, over the pelvic area of the animal. So again, he cannot get up. Okay, that is a couple examples for you of just really basic restraint.